An honor, I would like to invite Dr. Sunita up on the stage.
Good morning, everyone.
Good morning.
My name is Sunita, all the way from Malaysia, and today I'll be speaking, not be hypoglycemic. Then maybe you want to pay attention to the slides in a while. 20 minutes, as fast as possible. Diabetes reversal, is it possible? So what is diabetes? Diabetes has been defined by WHO as a metabolic disease where it is characterized by the levels of blood sugar, elevated levels of blood sugar. But what I'm trying to tell you, it is not the elevated blood sugar that causes the problem, it is the insulin levels that cause the problem. So if you have hyperinsulinemia, you get insulin resistance, but here we have patients who are normal blood glucose levels with very high levels of insulin and hence the insulin resistance. That's why we need to look at the insulin levels, not the glucose levels, to reverse diabetes. So the types of diabetes that we have, you have type 1, which is autoimmunity. Type 2 basically falls back to insulin resistance. Type 3, which is a type of diabetes in the brain where dementia sets in. It is also due to insulin resistance in the brain. Type 3C is damage to the pancreas. Any damage to the pancreas, be it pancreatic cancer, pancreatitis, cystic fibrosis, or strokes of the pancreatic artery can lead to diabetes. The last one, type 4 diabetes, is where patients are normal, they are not fat, they don't have insulin resistance, they are good, yet the HbA1c keeps climbing over the years. And we have diabetes in pregnancy. Now, why do we get diabetes? The main reason why we get diabetes falls back down to genetics, insulin resistance, pancreatic damage, hormonal imbalances, immune diseases, and pregnancy. So is diabetes dangerous? Well, that's why we are here, right? We want to know how to reverse diabetes. So why do we need to control the glucose level in blood? The main problem of HbA1c being elevated is your oxidative stress. And this oxidative stress is the one that will cause thrombus in your arteries. So the main key to reversing diabetes is to reverse this oxidative stress. Oxidative stress will cause cell membrane changes, it will increase blood viscosity, it will increase the erythrocyte fragility and inflammation. So how do we reverse diabetes when we already know the cause? We use probiotics, we look after the leaky gut, we look at the GLP-1 system, we look at the proteolytic enzymes, we lower inflammation, mainly oxidative stress, we lower visceral fat, increase the basal metabolic rate. That is the main key here today. If you can remember one thing from my lecture, is you need to increase the basal metabolic rate. Ozone and ozone and ozone. For 20 years, we've been using ozone, and it's the key also to reverse your oxidative stress. So you need to lower the insulin spikes and lower cortisol levels. So the first one, probiotics. There are two types of probiotics here that we are looking at. One is we are looking at the leaky gut syndrome or the gut wall lining, where you want to strengthen the gut wall to reduce lipopolysaccharides. Secondly, you want to increase the butyrate in the gut so that GLP-1 is being produced by the liver. So probiotics for diabetes, we are looking at Lactobacillus, Bifido, Saccharomyces, and your Bacillus species. GLP-1 probiotics are already being bottled, so it's easy to prescribe to patients. Akanmasia is what we need for diabetic patients to increase this GLP-1. And Lactospore is a company in India which produces Bacillus coagulans, which helps to strengthen the gut wall lining. Together with gut wall lining strengthening and the GLP-1 probiotics, you lower inflammation in the gut. Proteolytic enzymes mainly used for type 1 diabetes, where it helps to reduce the activated T cells. So what type of proteolytic enzymes are we talking about? we have trypsin, bromelain, papain and chymotrypsin. Please prescribe bromelain and papain and chymotrypsin to your patients in order to lower the activated T cells. Insulin resistance. The key to lowering or reversing diabetes is going to be the insulin resistance. So what is insulin resistance? In a layman's term, I tell my patients, when your cell is full, the insulin receptor will be downgraded. So if you understand that your cell is now full, please don't feed your cells any more food. Okay? So what happens when your cells are full? You end up with more adipose tissue, you end up with liver cirrhosis, and you damage the pancreas. And that's when your insulin levels now start to drop. So hyperinsulinemia is the key. You are looking at insulin levels because of insulin resistance, and you want to reverse or break this insulin resistance because you're trying to save your pancreas. We only have so many cells in the body that can produce insulin throughout your lifetime. So if you want to remain healthy, disease-free, please make sure you look after your pancreas. Now when insulin goes up, something happens. Your oxidative stress inside the fat tissue also increases. Now that is why reducing oxidative stress is so important, because if you make your fat cells inflamed, every cell in your body now is going to be inflamed, because every cell in your body is a biphospholipid layer. So if your fat tissues are inflamed, every cell in your body now is inflamed. So if Dr. Patana was here, he would be very happy with this slide, because sugar is poison and you have to break the insulin spikes. Break the insulin spikes. How to break the insulin spikes? So this is the slide which everybody needs to understand. To break insulin spikes, you need to be in a condition called metabolic flexibility, where the body can use either fat or carbohydrate, switch on and off when the supply and demand is there. So when you have signs of bad metabolic flexibility, you are in insulin resistant, you have high levels of insulin, and you never go into ketosis. Therefore, increasing the metabolic flexibility is going to be the key to reversing your diabetes. So why metabolic flexibility is so important for diabetes? We should never go hypoglycemic, because we can use fat or carbs any one time. So why should any one of us, be it diabetic or not, go hypoglycemic? It now falls back to your metabolic key, your metabolic switch, whether it's turned on or off. So ozone therapy, thanks Dr. Millie. Ozone therapy is what I use before every procedure in my clinic. Ozone therapy is there for patients who are non-G6PD deficient. Why? Because ozone increases an enzyme called 2,3-DPG, and with this enzyme going up, it lowers the glycosylated hemoglobin and it reduces the oxidative stress. So patients need an organ in the body called muscle. Muscle is not there for fun. Muscle is not there to look good. Muscle is an organ, and the reason why we need muscle is because muscle holds your mitochondria. It is the only organ in the body that holds your mitochondria. The more muscles you have, the more lean muscles you have, the lower your HbA1c will be. So losing fat is one thing, but building muscles are more important, because it is this muscle that will utilize the glucose and fat in the body. Now, testosterone therapy is something which is going to help muscle building. If anyone says, I don't need testosterone therapy, you are not going to have enough muscles in your later part of life. So testosterone therapy is not a libido hormone. It is there to build a organ called your muscle, and only with this muscle building will you be able to utilize all the fat and sugars in the body. So now, as we grow older, why is it that we become diabetic or our HbA1c rises? It's because of our muscle mass. as our muscle drops, the hormone levels in our body also starts to decline. We call it menopause and andropause. That's why you need testosterone therapy, because you need to keep your basal metabolic rate on the higher side. So one other key to burning sugars and fats in your body is going to be your basal metabolic rate. Now here, one hormone, thyroid, is there to raise or lower your basal metabolic rate. Now here, we are not talking about hypothyroidism. We are talking about subclinical hypothyroidism. That means all the thyroid levels ranges are still within the range, but clinically you have elevated amounts of cholesterol. Your LDL is on the higher side, your triglyceride is on the higher side, your HbA1c is starting to climb. Okay, the only way to bring down cholesterol and your HbA1c is to increase your basal metabolic rate. The basal metabolic rate can go up with building up of your muscles, or you give them thyroid supplementation. Thank you, Dr. Devil. Thyroid supplementation increases something called lipolysis. So unless you are able to pull the fat out of your liver, you will not be able to feed this fat into the mitochondria to be utilized. Exercise, very, very, very important. Now if you are feeding your cells with glycogen and fat, you need to make sure these cells now utilize the food that it's been given. So unless you are able to move enough to burn that amount of calories which you have eaten, you also need to have resistance training, because you need to build muscles. Only then will you be able to improve the fatty liver and improve metabolic flexibility. Now I have patients who come to me and say, I got no time to exercise. I got no time for running, jogging, walking, whatever. So I don't blame them, because I work in a clinic also, and most of the time we have to sit, right? So one way which I always tell my patients, if you don't have time to exercise, get yourself an FIR sauna. Because the FIR sauna, 30 minutes every day will burn the fat equivalent to an aerobic exercise. Lower insulin spikes. So whatever we do, whatever is at the end of your fork will be your choice of how you feed yourselves. So if you're going to eat carbohydrates, please make sure you wrap your carbohydrates with protein or healthy fats or with a lot of fiber. You can use apple cider vinegar if you want, but never ever eat carbohydrate empty. Always wrap your carbohydrate with either protein or fat to make sure it has a low glycemic index. This is what we are trying to achieve. Everyone can eat 3 meals a day if you want to, but you need to understand that the meal has to be wrapped. The spike of insulin cannot be so high that it cannot come down before the next meal. So what we are trying to do is you have 3 good meals, wrapped carbohydrate, you have 4 hours between each meal, and you have a 12-hour fasting period every day. So when you are awake, your metabolic switch uses carbohydrates, and when you are asleep or fasting, you use fat. So in this way, you burn the carbohydrate and you burn the LDL from your liver. Inflammation, inflammation, and inflammation. It is the key to all diseases. You need to make sure that your oxidative stress is always on the lower side. Hence where ozone comes in, because only with ozone you can remove the glycated glucose or hemoglobin, the attachment of glucose to the hemoglobin by giving ozone therapy. Inflammation and also oxidative stress. Now, this is why vitamin C and ozone comes in hand, because unless you lower inflammation in the fat tissues, there is no way you can burn the fat. So, reversal of diabetes can be achieved when HbA1c is lower than 5.7. I keep it at 4.8 to 5.0 only for one reason, because you want to lower your oxidative stress. HOMA-IR is less than 2.6. Serum insulin levels anytime time you check your serum insulin levels, be it fasting or non-fasting, it has to be lower than 25. Now, do remember that when we have food, our glucose levels may be normal. Most of us here will be normal. It is the insulin response to the carbohydrates that you have eaten that is the one that is wrecking your metabolic switch. You need to make sure inflammatory markers are on the lower side. There is no dyslipidemia. Muscle mass is optimized. The most important organ in your body is your muscle, and you are looking at 3 kilos of upper limb muscles per limb, 9 kilos of lower limb muscles per limb. 24 kilos of muscles is the minimum amount of muscles that you need to burn sugar and fat. And that's when your metabolic flexibility comes in and you burn sugar or fat with the metabolic switch. So reversing diabetes is actually all about metabolic flexibility. Thank you.